Hey there. So it has been 3 days since my surgery. Um, Talking is on and off a challenge. Um, Sometimes it's a bit easier than others. Right now, my teeth are a bit sore, or my gums, I should say. Um, so that's why I'm talking a little funny. So I hope you can understand me okay, anyways. Um, so my surgery was 3 days ago. Um, They gave me some Gravol after the surgery. I felt a bit nauseous. Um, don't remember much other than that. Um, just that I felt nauseous. Um, my wife, basically, they lost me somehow in the shuffle. Um, I was always somewhere, and they knew that, but it didn't seem like they were related to the right people. And the doctor didn't really come out and talk to my wife after, so um, I think that created a little bit of panic, and but thankfully she found me, and I was okay. Um, I woke up with my dentures in, and I said to my denturist, it kind of helped, I think, because I knew I had something in my mouth, and I didn't feel all the tissue and everything basically that they had taken out. I didn't feel all the gums and stuff. Um, didn't really know I had anything in my mouth, other than when I bit down. You could feel teeth were there, um, but I was so numb you couldn't really tell. Um, that lasted, I think, most of the day. Um, Went home, slept a little bit, and ice, lots of ice. Um, Day two was really a lot of sleeping, icing, more ice. Um, Lots of antibiotics and mouthwash antibiotics. Um, I just got the okay yesterday to start taking my dentures out 3 times a day. Give them a quick rinse and put them back in. And my doctor said within the next week I should have the denture sticking, so I won't really have to fight with it. It's staying pretty good on its own right now, but yeah, it is a little hard to talk right now. Um, you can tell it's getting a little bit better as I talk, so um, hopefully you understand everything. Um, yeah, it's been pretty much a lot of rest. Went to the dentist yesterday, first time since surgery. Um, he just checked on things. Kind of shaved the denture along here, so it was brought down a little more, um, so it's not pressing on my gums. Um, but I guess next week we're doing my first realignment, and until then I'm allowed to take dentures out 3 times a day, um, just for a quick rinse and then put it back in after. Um, it was quite the process. Wasn't too bad overall, but it's definitely different trying to eat things. Yogurt I have on the table beside me, juice. Can't use a straw at all. Milkshakes are my best friend right now. They're really easy to drink. Um, the sides of my mouth right here and here, you can kind of see something. That where the skin is healing because I had to stretch my mouth so far. Um, so I really don't look like this on a daily basis, but it's just my gums trying to heal, so that kind of prevents me from smiling and talking a little, but I've been using polysporin to help with that. Um, it's been an interesting road. Um, thankfully it's not been too bad. I'm just glad it's all over now. Um, I guess I avoided most of my swelling, as although, looking at myself it doesn't look like I did. Um, but I have some swelling up in here, you can kind of tell. Um, so I should get icing it soon. Um, that seems to help a lot with the pain. Um, so just keep icing it if you have it done. Um, the bottom denture was a little hard to take out, I have to admit. It's a partial denture. So it's kind of hooked on right there. And the lips are a little rough still. Um, but it's a learning experience, that's for sure. Top one's easier to take out by far. Um, kind of weird going to the grocery store trying to find, stuff I need. It was a bit getting used to. Felt like I was in the wrong aisle kind of thing. I think they're all roughly the same stuff, but even I was confused by it. So it's been a lot of homework, a lot of reading. The one video I found on YouTube, a younger girl that did her dentures. I think it was KG Links. I apologize if I got it wrong. Really nice girl. She really helped me kind of understand what I was going to go through. The surgery, I think, was a lot more hype than it should have been. My mom works in the operating room, so I'm used to kind of knowing what's going to happen. And obviously, teeth are coming out, but, didn't know what to expect after, or, what it was going to feel like, or, just kind of the days after. The doctor never came out and talked to my wife or myself, so I was a little disappointed in that. But, some surgeons aren't really have a good bedside manner. He's obviously very good at what he does, because I haven't had any problems. But still would have been nice if he had come out and talked to my wife. I'm kind of feeling my way through what I can eat and can't eat. Somehow I was able to eat Swiss chalet chicken last night. Couldn't eat the fries or anything. I just broke up the chicken, dipped it in chalet sauce, and kind of felt my way around eating it. Chewing isn't really happening right now, so, the more non-solid, I guess, the better. I think it's comfort, too. I'm not sure if I really kind of start to eat that. So I'm trying to stick to soft foods, just while the gums heal. I beat most of my swelling, like I said. I guess the first 3 days is usually the most crucial for the swelling. And so thankfully I've been icing it, taking some pills, following a pretty, steady regime. And aside from going out and trying to talk, obviously, like, it is difficult right now. From what little I've gone out, people haven't really looked at me, and I'm sure I opened my teeth. Sometimes for breathing. Breathing on my nose with my allergies can be difficult. So breathing out of my mouth isn't uncommon, and even right now you can sort of see my teeth. And it's kind of a nice feeling, I have to say, to be able to open my mouth and not really worry what people see. I feel a little bit of pressure around my mouth and my gums, but it's nothing that obviously people can see. My mom, my denturist, and my wife have all commented. My wife has commented quite a few times already how good my teeth look, and that's without me really smiling. Um, so it's kind of nice, and it's a slow process. It still hurts right now on the sides and that, um, but I can slowly go out and do things. I drove myself to my appointment yesterday, just 10 minutes down the road and back. I didn't really push it. Um, I'd like to go today maybe, but we'll see how I'm feeling. Um, I think trying to get back into regular day to day is the tough part. Kind of lost all concept of day and time. I've been off since Tuesday. It's now Friday. Um, and I'm already ready to go back to work. I'm sure I bothered my coworkers enough. Um, but being a home care worker, obviously I need to be able to talk to my patients, and some of them can't hear very well, so talking like this probably won't help. Um, and, they are right. Rest is probably the best thing to do. Um, the big one right now is just following the regime set out for me, or the care plan, I guess, by my dentures, just to make sure, I heal right, I do everything right like I'm supposed to. Um, that's the big one. I really do want to heal properly. Um, so I'm really trying to follow the regime, and I even set the alarms on my cell phone so I don't forget to take my pills and that. That seems to help. If there's any questions, please feel free to email me. Um, I really don't know what to tell you. It's not too bad an experience.